Part 5, After Death, for the Family. Experiencing the death of a loved one may be a very emotional time for you. If your loved one is dying in the hospital, the nurse will help you to contact a member of your church to visit. When your loved one dies, the nurse will also help you to contact the funeral home to take the body to the funeral home. If your loved one dies at home, take as much time as you need to sit or hold your loved one. Then, when you are ready, you would phone your family physician to come to your home to complete the special forms called Registration of Death. The community health nurse and the family physician will help you to contact the funeral home to come to your home to take the body. You do not need to call the 911 hospital number. Experiencing the death of a loved one is very difficult. If your loved one dies in hospital, they will arrange to have the funeral home pick up the body. You will need to notify the doctor so they can come and pronounce the death and fill out the death certificate. If your loved one dies at home, you will need to notify the funeral home so they can come and pick up the body. Sometimes it is easier to arrange for the funeral before they die. It all depends on the wishes of the family. In the days following their death, you will need to notify their insurance company if they had life insurance, pension plans, provincial health insurance plans, Canada Revenue Agency, social services, and other organizations. Grieving after the loss of a loved one can be a very challenging experience for caregivers and family. Grieving is different for everyone. You may experience a range of emotions from sadness to anger or guilt. Sometimes you may feel a sense of relief when your loved one dies because their suffering is over. This is normal. It is important to talk to others during this grieving period so you can express your feelings. Grieving and getting over the loss of a loved one can take months or years, depending on the person. Don't feel upset if it takes a long time to overcome your grief. Eventually, the pain of losing a loved one will begin to ease. It is important to take care of yourself during this time and try to resume your daily activities. Concluding comments. Facing the terminal illness and death of a loved one is never easy. Having good information and asking the right questions can help. The goal of palliative care is to provide help and support for people living with a terminal illness. Palliative care tries to meet your physical, emotional, spiritual, and social needs while you were ill. Every person will eventually die. The goal of palliative care is to help people live well and without pain or suffering until they die. We hope you have found the information in the video helpful. If you have any questions, please contact your family doctor, palliative care service, or Department of Social Services or Community Services for assistance. Thank you.